As mentioned in part 1, I have needed to develop my confidence level and attention to detail, which were my weaknesses while working in the patient care. I have chosen interpersonal communication skills as my strategy to develop my presentation skills, confidence level to face in front of the team, patient, and carer. Communication plays a crucial role in addressing the needs of the patient need and care process. As a nurse, we are required to communicate effectively, listen with empathy, and advocate for the patients. What I am lacking is that I am a bit shy, hesitant to talk to the patients, families, and carers, and the treating team where I have to build my confidence level. During this semester, I had some approaches that enable me to implement my personal strategy to achieve my goal. Whether that is at work or in my clinical placement, I started making plans, writing every details that I have to do and complete, and watch videos, read articles when free to get more knowledge. I have some points that I have to follow to gain my knowledge, to gain my achieve my goal. Number one, I plan and prioritize the task. Number two, get the things done appropriately. Number three, get involved in discussion. Number four, write down the points to improve from every task. Number five, talk to the patient and care team appropriately. Number six, be prepared. Number seven, get enough rest. Even though I have practiced a lot to overcome my weaknesses, I still need more to do to become competent. I still need to continue improving my skills to be competent in graduate year. So my plan for further development is to continue with the strategies I had, and some points are as follow. Be prepared. Listen to others. Follow advice and lesson from the seniors. Continue to work to improve my weaknesses and experience. In this presentation, I'm going to focus on the domain of communication and interpersonal skill, such as self-confidence, time management skill, which are the foundation of my relationship with the patients. Developing competency in this domain will enable me to gain my confidence level as well as attention to detail required during this patient care. I'm going to use Gibbs reflection model on reflecting my interpersonal skill experiences during my study and clinical practice. During the semester and clinical placement, I had chance to develop my interpersonal skills to enhance my ability with the patient care. I was involved in patient care in different settings and places. During the period, I focused on developing my skills in attention to detail, time management skill, developing self-confidence, and deal with the different patient scenarios. Under the supervision of the RN, I started taking the handover, emergency check, head-to-toe assessment, pain assessment, writing progress notes, doing the care plan, taking to the talking to the treating team, and I started initiating. I started talking to the patient, assisting with the activity of daily living, and completing the vital signs and required assessment on my own. At the beginning of the placement, I was feeling very nervous and all found myself learning a lot with the help of RN. But although I got enormous help from RN, who guided me to increase my confidence level and to communicate more effectively, plan my daily tasks, pay attention to detail. I was feeling overwhelmed with the support from the RN and the clinical team, where I was able to show my interest in learning the clinical practices. Attention to detail and time management and the skill were always in my priority during my clinical placement, where I spend most of the time in looking at the small details nurses do in patient care, along with the time management to finish the task on time. The support and encouragement and the tips nurses gave me were strong assets to improve my skill, such as making daily plans, completing assessment, filling up the charts, writing notes, making progress notes on time, which gave me a lot of hope of progressing myself to practice and to be the nurse. When started my placement, I was a bit nervous to approach in front of the patient, even though I was familiar with the procedure. Along with the help of the RN, I was more confident and I started taking the initiation of taking the patient care and patient load as well, and writing the notes and doing all the activities that nurses do. What pleased me is the enormous support in every step of the RN's in every step the RN support to achieve my goal in nursing learning. With the inner encouragement and support, I stayed focused, keen, and curious in learning process and helped every detail from RNs and care team to achieve my goal. I plan to continue to increase my weaknesses in nursing learning. More importantly, I need to focus on time management skill to finish my task on time, which I'm still lacking. Along with that, I'm going to continue to develop my confidence level during my new graduate year.